everyone. Today we're going to talk about something a little bit different. Normally I talk about various plastic surgeries, how they are done and what kind of results you can get. But today our topic is about how you can get surgery done safely. Specifically, what are the investigations that we do before a surgery, why these investigations are important, and how you can have a safe cosmetic surgery experience. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center Bangalore, and let us talk about this. Now, first of all, what are investigations? Why do we do them? Investigations can be anything that tells us how your body is functioning. These include blood tests, they include radiological tests like X-rays, they include tests like ECGs. All of this basically tells us about your body state and tells us about how fit you are. And this tells us if you are a good candidate for a cosmetic surgery or not. Now, why is this important? Cosmetic surgery is very safe, but when it is done in the right person. For that, investigations are important. Surgeries can go wrong if it is done by the wrong person, on the wrong patient, in the wrong place. What do I mean by this? The wrong person means the wrong surgeon, a surgeon who is not qualified to do that particular surgery. So check your surgeon's credentials to make sure that he is appropriate for the surgery you are planning. The wrong place means if it's done in a facility, it does not have all the requirements to conduct a surgery, and if it does not have appropriate safety standards and safety backup. So make sure your surgery is being done in a place where all the facilities are state-of-the-art, up-to-date, and all protocols are followed. And thirdly, the wrong patient. This is what we are talking about today. The wrong patient means someone who is not fit, whose body is not fit to undergo surgery. Surgery is a stress on the body, so the body needs to have enough strength to take on and recover from that stress. And that is what investigations help us find out. So what are these investigations? Let us go over some of them. These are the ones we most commonly use. It's not an exhaustive list, but the ones we do most commonly include a CBC or a complete blood count. This tells us about whether you have enough hemoglobin, all the cells in your blood are normal. It also tells us things like whether you have recently recovered from an infection or not, if you have anemia, if you have any bleeding disorders. So this tells us about this. The next thing is what are known as clotting parameters, your bleeding time, clotting time, prothrombin time. This tells us if your blood clots normally. Obviously, this is important. In the surgery, we're making cuts. Those cuts, the bleeding has to stop and your body has to be working normally for that. If this is not checked, it can cause a catastrophe on table and the person's life can also be in danger. Those are the blood parameters. The next are various organ parameters. These include liver function tests and kidney function tests. What these blood tests tell us is how your liver and kidneys are doing. Why is this important? This is important because the medicines that we give during the surgery to perform the surgery are one, metabolized by your liver, and two, excreted by your kidney. If your liver is not working well, such as in people who are heavy alcoholics, or if your kidney is not working well, such as people with various diseases, then these medicines can lead to toxic levels in a person's bloodstream. Again, this does not happen in a normal person, but no one walks around a board saying that I am normal. That is why these blood tests are done. The next one are hormone-related. These include your thyroid function tests. This tells us if your thyroid organ is working normally or not. If it is not working normally and your thyroid levels are abnormal, then some of the medicines given during surgery can trigger various hormonal effects which can cause serious issues. In the same vein, it's also important for us to check your blood sugar or a random blood sugar and a HbA1c. HbA1c is also known as glycosylated hemoglobin. This tells us how your sugar control has been over the last 3 months. Why is this important? If someone's blood sugars are high, then they have a higher chance of getting an infection after the surgery. They have a higher chance of other complications after surgery. So this is the reason why blood sugars need to be checked before surgery. The next test is an ECG or an electrocardiogram. This tells us how your heart is working. Now before, we used to do ECG only for bigger surgeries, but nowadays we do it routinely even for the smallest procedure. The reason for this is we are seeing more and more young people with cardiac conditions, with heart issues. And obviously if someone has a heart issue, one, the stress of surgery can be a problem. Two, giving general anesthesia can be a problem. So this is why we need to get your ECG checked out. And you might be surprised, someone who is completely asymptomatic, looks perfectly normal, someone who runs, who exercises, they can have heart conditions. So this should not be taken lightly. Even without any surgery, someone who crosses 30 should get a checkup done of their heart. The last one is a chest X-ray. Now this is something that we would do if someone's undergoing general anesthesia. This is important because in general anesthesia, there's a tube put in your throat and your breathing is taken over by a machine. If someone has a chest infection, this process can make the chest infection worse and they might not recover from the anesthesia. That is why a chest X-ray is done. It's not done for local anesthesia procedures, it's needed for general anesthesia procedures. These were the routine investigations done. Based on the person, some other investigations might be required. If someone already has a cardiac condition, we might do an echocardiogram instead of an ECG. If any of these parameters come out to be abnormal, we might ask for a specialized opinion from a physician, from an endocrinologist, things like that. But overall, this gives an overview of the kind of investigations we do before a cosmetic surgery to ensure your safety. Now coming to safety, this is again a reason why you need to choose the right place for your cosmetic procedure. Some place where the doctors are not experienced, they might take shortcuts in these tests. Some place where the only focus is on making the procedure as cheap as possible, they might remove some of these tests just so that to save some money. And that is not a good idea. Remember, cosmetic surgery is still surgery. Take it seriously. Everyone has heard of people dying from cosmetic surgery for whatever reasons. One of the reasons is, as I said, if it is done on the wrong person, someone in whom that cosmetic procedure should not have been done. And that means that their body wasn't fit to be able to undergo surgery. So that is why don't play with your life. Choose the right place, do your research, get your surgery done by the right surgeon in the right place when your body is ready for it. I hope this video helped you understand how important it is to take safety in cosmetic surgery seriously. If you like this video, do share it, subscribe. Thank you. Have a great day.